Hello and welcome to this week's What Were They Thinking? Let us begin with news about the CCP virus and the risk to young adults. It's currently proposed that young people are less likely to die from the CCP virus. This is all well and good, but that does not mean they are not at risk of being infected. In theory, it could be as high as 1 in 3. That relative risk is derived from a number of risk factors that put a smaller proportion of the adult population at higher risk. Currently, it's thought that around 25% of all hospitalizations for severe patients are aged between 18 and 49. The reason that's so high owes to that 25% engaging in behaviors or having various intrinsic factors that could put them at greater risk. This includes things like diabetes, smoking, liver disease, and so on. The idea that smoking, for instance, would put you at greater risk of a respiratory disease shouldn't be a surprise. After all, it is a behavior that actively harms the lungs. This is yet another piece of evidence in the larger picture of the CCP virus and how this pandemic is not just simply a case of protecting yourself by wearing a mask, developing a vaccine, and many other measures, but that there are a variety of factors that drive the disease, both to its benefit and against ours. While talking about the spread of the CCP virus, another study has indicated that they believe up to 40% of people with the CCP virus will demonstrate no symptoms. This is an important factor to be aware of. Most people rely on symptoms to be able to know whether or not they are ill and then take action. A running nose, a fever, a cough, all of these are signs that you should wear a mask or quarantine yourself. The problem is, those who don't show symptoms don't take these actions. The problem they then present is that they have a 75% chance of spreading the CCP virus. That means there is a silent percentage of the population who could be spreading the disease unknowingly. An important factor to be aware of, with various states in the United States of America showing drastic increases in the number of infected individuals. These states are demonstrating a variety of behaviors not consistent with best practice, and as a consequence, we don't know exactly how it's spreading other than the fact that infected people are coming into contact with either people who have recovered or those who have not yet been infected. This has led by decisions from the USA to try and push for students to return to school, and that's raised concerns. The concern is that students, although unlikely to be adversely affected by the CCP virus, may act as these silent carriers, or asymptomatic carriers who spread the disease to vulnerable individuals. The concern is what would happen if school children were infected by being exposed to each other, and some of them carried the CCP virus while others did not. They could then take this home and put their friends, family, and loved ones at risk. That risk is more than just that they may die. There are concerns that continue to grow about the long-term implications of the CCP virus. Brain damage, lung damage, heart damage, and now heart abnormalities identified through scans. There is concern that the CCP virus could be causing even more damage than we previously thought through blood clots. Blood clots can cause stroke, heart attack, and more. They prevent blood flow to essential organs, and if they don't prevent blood flow, they reduce it, which thereby causes damage. The research found that there was a roughly 1 in 7 incidence of severe abnormalities in the patient's heart. The majority of these were not previously identified patients, and they had no history of abnormalities with their heart function. This means it is most likely a consequence of the CCP virus or something underlying that has been severely exacerbated by the CCP virus. While that may be an end-of-life or at least later-in-life concern, there are worries that pregnant women, if they are infected with the CCP virus, may be able to get it through the placenta thereby infecting the developing fetus. This comes from a study published in Nature. This is backed up by evidence of the placenta becoming inflamed, like other organs have been when exposed to the CCP virus. The mother was also admitted to hospital with all the symptoms of the CCP virus. After birth, the child exhibited the symptoms of the CCP virus in an infant. This would indicate that yes, there is considerable concern that pregnant women, if they are infected, could also infect their developing fetus. While still on the topic of children, we mentioned earlier that there was concern about the possibility of children becoming infected, and we now have numbers to back this up. About 1/3 of children in Florida have tested positive for the CCP virus, and yet still the American government is pushing for schools to be reopened. On average, 31.1% of the children they tested came back with the CCP virus. Florida has a statewide average of 11%. This means children are at 3 times the risk of being infected, but they may not show symptoms of having been infected. This is a staggering issue to bring up when you consider that the government is pushing for children to go back to school, and as we mentioned earlier, possibly act as a conduit between infecting other children and those within the household. We then need to combine this with the concerns we've just described about the possible short-term and long-term health effects the CCP virus may have. Imagine what will happen if an entire generation of children is physically incapacitated or at least has greatly diminished physical abilities due to being infected by the CCP virus now. While it may be slight hyperbole, it's good to compare this to events like World War I and World War II, where entire generations of young people were scarred, disfigured, and damaged through war. When they returned to society, they were unable to function to the same level they were beforehand and carried these injuries for years, and it took society decades to recover. While we're on the topic of the CCP virus and misunderstandings about what we should be doing, we want to touch on the criticisms of Dr. Fauci. It seems as though a lot of people are jumping on the bandwagon of criticizing him for his inability, or at least limited ability, to get things under control in America. The problem is simply this. The CCP virus is something we haven't had to deal with in over 100 years. The nearest comparison is the Spanish flu. Expect any one individual to be able to get it perfect immediately in an environment that nobody knows exactly what is happening and how to deal with it, let alone with uncooperative individuals, as we've seen with many states in America, is an unreasonably high barrier. To put it another way, imagine Hollywood horror films about the zombie apocalypse. Within those, how many times have you seen characters criticized for being unable to deal with the zombie apocalypse? And we could take a similar point of view with how Dr. Fauci has dealt with this. He has done what he can as he can with the current information and circumstances. These circumstances change almost day by day, and at sometimes hour by hour, as new discoveries are made. While perhaps not the most nimble or quick to change, Dr. Fauci has endorsed, accepted, and worked with the new evidence to try and bring out the best possible response to the CCP virus and how to handle it. That handling should hopefully come to a head in the very near future. One CCP virus vaccine looks to be going on to the final stage of human trials before it can be released for public use. This is a Phase 3 trial with 30,000 participants in the USA. Some of these will receive the vaccine, and others will receive the placebo. It's intended to find out whether or not it can be safely deployed on a large scale, and if people will still get infected. It's that last part that'll be hard to figure out, especially what we've described about the asymptomatic population that exists. Despite that, with at least 15,000 people having received the vaccine, it is hopeful that they can tell whether or not it's working. A reduction in severe cases would be considered a success in this instance. The problem right now is that we won't have any end to the trial until the end of October. That means we won't have results until probably the middle of November. At least based on the initial results, the 2-stage vaccination regime gave antibodies that were acceptable the first round, and after the second round of vaccination, they had higher antibody levels than those who had been exposed to the CCP virus itself. While we've spoken about the long-term implications for the CCP virus and how they can drastically alter the body's ability to function, an interesting study has come out that might help with dealing with some of these effects. Fundamentally, the idea is you can hook the human body up to a pig, run the body's blood through the pig, and then allow the body to recover this way for some bizarre reason. The idea comes down to this: they can join the circulation to that of a pig, and that somehow this allows the body's self-repair mechanisms to exceed what would normally occur. This has allowed researchers to take lungs that were otherwise too damaged for transplant and repair them to a point where they can then be used. The upside to this new method is that where previously you might have 8 hours where you've hooked up lungs to a synthetic system that would support it, this allows them to be supported for up to 4 days. The idea of using pigs in particular is not novel, and there is research looking at whether or not organs can be transplanted effectively. But at the moment, we are currently using pigs in lieu of, say, livers, where the pig liver does provide an acceptable degree of filtration and treatment for the body. The blood can be perfused through the pig and then cleaned up and put back into the original human host. For the same reason, it is theorized that we could use this same method to support other medical devices with much shorter term viability for organ transplant to try and recover some of these organs that would otherwise be unacceptable. Going now from the future of medicine, we're looking at a historical study of syphilis within London. London was a hotbed for a variety of STIs throughout the 18th century. This owes to a drastic increase in the money for those who were rich, poor working conditions for the poor, and a significant gap between it that led to poor conditions for those all around. This, along with the growing population, meant that debauchery was high, and syphilis was spreading very quickly. This is the situation underpinning the research that would show 1 in 5 Londoners had syphilis by their mid-30s in the 18th century. This is twice other major metropolitan cities in the UK, and 25 times that of the rural parts of England. That is a huge difference between them. At this time, there was no viable treatment for syphilis. To a degree, they could use things like mercury to knock it down and try and suppress it, but it would not go away. It was only the later development of penicillin that allowed the treatment of syphilis. That is all the news we have for you this week. Thank you for watching. If you have found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions below.